Hello. Welcome to DRA Rosa's channel. Even people who don't have diabetes can suffer from blood sugar spikes. That's why it's important to recognize the symptoms and signs in order to better understand the process and thus prevent or treat the disease. Let's understand the process. It's important to mention that type 2 diabetes is the most prevalent. The vast majority of cases are silent at first and only show signs later on. Type 2 diabetes mellitus is a chronic metabolic disease characterized by high blood glucose levels. The disease has been growing rapidly among the world's population in recent years, and around 40% of people who have a change in their blood glucose are unaware that they have this health problem. If not treated properly, the disease can lead to alterations in important body systems such as the circulatory, nervous, and renal systems. Diabetes is a disease in which there is an increase in glucose in the blood. When we eat, the amount of glucose in the blood naturally increases. This glucose is transformed into energy for the body to function, thanks to the action of insulin. Insulin is a hormone produced in the body by an organ called the pancreas. Diabetes occurs when the pancreas produces too little insulin or when there are problems with how it works. If this is left untreated, the amount of glucose in the blood begins to rise, reaching levels above normal, called hyperglycemia. Some of the symptoms that may serve as a warning are excessive urination, excessive thirst, excessive hunger, weight gain, tiredness, blurred vision, weak immune system and abdominal pain. 1. Excessive urination. Excessive or more frequent urination is another symptom of diabetes. This is because the kidneys are unable to reabsorb all the filtered glucose, which is eliminated along with a large amount of water. This leads to a feeling of dehydration, which causes the patient to drink more fluids. This creates a vicious circle. 2. Excessive thirst. As sugar is not properly absorbed by the cells of people with diabetes, it accumulates in the bloodstream. The excess needs to be expelled from the body, so the kidneys are frequently called into action. The patient then urinates a lot, becomes dehydrated and very thirsty. 3. Excessive hunger. But why do people with diabetes feel very hungry? Because insulin can't work efficiently to control blood glucose levels, the body tends to work harder than usual to eliminate excess sugar. And this hyperactivity increases episodes of hunger. Enjoying the video? Don't forget to help me by giving me a like and subscribing to my channel. Thank you. For weight gain. In type 2 diabetes, the pancreas still produces insulin, but it doesn't work as it should and blood sugar levels become high. In this case, some patients end up overweight or are considered obese, increasing their risk of developing type 2 diabetes. The truth is that obesity is a risk factor for diabetes. But what isn't often talked about is that this relationship is a two-way street. Those with diabetes, especially type 2, also find it harder to lose weight. This happens because of what we call insulin resistance. Diabetics lose muscle mass. High blood sugar levels make muscles weaker because they damage nerves and muscle fibers. The patient then experiences muscle fatigue. 5. Tiredness, fatigue. Extreme fatigue, chronic tiredness, too much sleep, lack of energy for everyday activities, frequent laziness and dizziness are common symptoms in cases of diabetes. They occur due to dehydration caused by polyuria and the inability of cells to receive enough glucose. 6. Blurred vision. Excess glucose in the blood causes the lens of the eye to swell, changing its shape and flexibility, reducing its ability to focus and blurring vision. 7. Weak immune system. Excess glucose can damage the immune system, increasing the risk of people with diabetes contracting some kind of infection. This is because the white blood cells, responsible for fighting viruses, bacteria, etc., become less effective with hyperglycemia. Despite not being a virus, diabetes mellitus is a disease that can cause a reduction in immunity. Vision often becomes blurred when blood glucose is too high. 8. Abdominal pain. Diabetes mellitus can cause complications in the digestive system, including gastrointestinal symptoms such as nausea, vomiting, abdominal pain, heartburn, dysphagia, constipation, diarrhea and fecal incontinence. The health problem occurs when sugar is not burned and insulin has to store it through the accumulation of fat, especially in the belly area. The size of the belly can also indicate diabetes, because as the waist increases, so do the treatment and care. Choose foods rich in fiber and low in fat. Avoid sugar and foods high in refined carbohydrates such as bread, cakes and soft drinks. Control your weight. Do exercise regularly. Reduce your consumption of alcoholic beverages. Stop smoking and keep your cholesterol and blood pressure under control. Take care of your health and always see your doctor. I'll be posting more important health information soon. Thanks for watching and don't forget to like, share and subscribe to this channel.